Hi, my name is Lahoma. I'm a Wallen University student. I'm going to be doing a head and toe assessment and also head, ears, eyes, and throat for my patient, Mr. Michael Johnson. Okay? Hi, Mr. Michael. How are you? I'm Lahoma. I'm going to be doing an assessment. I'm going to go wash my hands and I'll be right back. Okay? All right. So I'm going to do a head to toe assessment on you. I'm also going to check your head, your eyes, your nose. First, I'm going to ask you some history. Do you have any history of or family members of skin cancer?
No.
What type of work do you do? Do you work in the sun?
A little bit is good.
Okay. So you wear sunblock?
Yes, okay.
Okay, so that's good. Yeah, you always want to wear sunblock and then reapply as you go throughout the day to protect your skin. All right, so first I'm going to start with your head. I'm going to check your head. Your head is symmetrical, so it's nice line. All right, let me just feel along here. I don't feel any swollen lymph nodes. I'm going to look at your hair. Can you mind me looking through your hair? Okay. Okay, hair is intact. There's no hematomas or redness noted in the scalp or rash or extra dryness. Very good. All right, let me look at your eyes. I see you wear glasses. Is that for far distance or?
Nearsighted.
Nearsighted? Okay. Can you mind removing your glasses for me? All right, so I'm going to look at your eyes. You don't have to move. You just look straight forward, okay? Okay, so that's the left eye is nice and pearly and reactive to light. So also is the right eye. All right, so I'm just going to look at your conjunctiva. Just look forward. Thank you. Conjunctiva is nice and pink. Blood vessels are intact. There's nothing bulging out or anything on Mr. Johnson. All right, Mr. Johnson, your ears. All right, so your ears are nice and symmetrical. So now I'm going to go look in your ears, okay, Mr. Johnson? All right, so your membrane is intact, nice and shiny. All right, on both ears, there's no redness or nothing noted. Do you have any ear pain or anything? No. Okay, great. All right, so now I'm going to use the turn it forward, okay? I want you to tell me what you can hear.
Yeah, vibration.
Vibration, thank you. Also on this side, what do you hear?
Vibration.
Okay. Now I'm going to go back here. Can you tell me if you hear anything?
Yeah, vibration.
Thank you. All right, Mr. Johnson, what about here?
Vibration.
Thank you. So now I'm going to do a whisper test on Mr. Johnson. Mr. Johnson, I'm going to whisper, and I want you to tell me if you hear anything, okay? Did you hear anything?
Mm-hmm.
What did you hear?
Say that you love me.
Okay, I'm going to do the same thing over here. You don't have to say it loud. Do you hear anything?
Yeah.
Okay, what did you hear?
Say that you love me.
Okay, all right, Mr. Johnson. So now I'm going to check, look at your mouth. You can put your glasses back on if you like. Thank you. All right, so now your nose, Mr. Johnson nose is nice in the line. There's no deviation or nothing. I'm going to check inside your nose. I'm just going to use my light and look in your nose, okay? All right, nice and pink, no redness, no polyps or anything noted in Mr. Johnson's nose. And I'm going to look at your mouth, okay? Can you open your mouth? All right. All right, dentation's intact. Let me see your throat. All right. Throat is nice and moist and dry. I'm sorry, moist and pink. There's nothing noted on the lips. Skin is intact there. Let me look at your neck. Neck is intact. Trachea line is intact. All right, Ms. Johnson, do you mind taking off your shirt for me? Thank you. All right, Mr. Johnson. So thank you for taking off your shirt. I'm back. I'm now going to assess your skin, okay? Have you noticed any rash or anything in your skin?
No.
All right, so just looking at Mr. Johnson's skin, I noticed that he doesn't have any rash or redness on his skin. Skin looks intact. I'm just going to feel and palpate for any bumps or any area, raised area. Let's see your back. Back is nice and intact. Let me feel your pulses here. Pulses are pounding times +2 on both radial pulses. Thank you. What about your fingers? Let me see your fingers. I'm going to look at your nail beds, okay? There's no clubbing or stenosis on his nail bed. And let me see. Cap refill, left hand is less than 2. Cap refill, right hand is less than 2. Thank you, Mr. Johnson. You can put your hands down. Can you stand up a little straighter for me? Thank you. Normally I would do this assessment lying down, but I'm going to assess him straight, standing. Thank you. So I'm looking at him. He looks aligned. Let me check your feet. There's no edema or anything noted on Mr. Johnson's feet. Skin is intact, no redness. Toes cap refill also is less than 3, less than 2. Glottal piso pulses is +2 bilaterally. All right, can you just sit down for me? All right. Okay, knees, there's no redness or dryness to the knees. Thank you, Mr. Johnson. You can stand up. All right, Ms. Johnson, thank you for allowing me to assess you. And you have a good day, okay?
Okay.